I'm Susan Taylor with Scripps Health in San Diego, California. Okay, ladies, we know this is a tough one. You sneeze, your bladder leaks. You cough, same thing happens. Urinary incontinence is embarrassing, it is frustrating, it can affect your quality of life. But there are ways to treat bladder incontinence and other pelvic floor disorders. Joining us to talk about this is Dr. Varuna Raizada. She's a urogynecologist with the Scripps Clinic Medical Group. Doctor, thanks so much for being with us.
My pleasure.
What is the pelvic floor and how does it work? What does it do?
Pelvic floor is a group of muscles that support our internal organs like the uterus, the bladder, as well as the bowels. And a good, strong pelvis keeps the organs in their place and neurologically intact so that you can function properly.
And what are the most common pelvic floor problems that you treat?
I commonly treat leakage of bladder, bowel leakage, prolapse, issues with bladder pain, frequent bladder infections. These are all within the realm of my practice.
And what is prolapse?
Prolapse is a condition where the vagina walls are no longer supported by the surrounding connective tissue and they begin to invert from the inside to the outside, and you begin to notice something bulging out of the vagina. If the walls involve the bladder, then you may even have some bladder symptoms.
And what causes issues like bladder leaks or prolapse?
There are multiple reasons. It could be genetics, childbirth, getting older, menopausal changes. These are all part and parcel of some of the things that can cause these issues.
How can somebody tell if they might have a pelvic floor disorder?
You may present with issues like bladder control, where you are unable to control urination with coughing, sneezing, laughing. You have a strong urge to go to the restroom, but you can't quite make it there. You have bowel leakage at times when it's unexpected. You may notice something is protruding out of your vagina that you can touch and feel and is very uncomfortable. And it may be worrisome to you, and sometimes patients may even go to the emergency room thinking something is wrong. But bring it up to your primary care doctor. These are very common issues, and there are lots of treatments available.
Who is most at risk for these things?
Women in general are more at risk than men, though it is not uncommon for men to have this as well. We find that women who are older, maybe overweight, smokers, these are all women and men who may be at higher risk. But as far as genders go, we do see this more commonly in women than men.
So how do you diagnose these conditions? What should patients expect during an evaluation?
A good pelvic examination is key, along with your history. And sometimes we may need to do other tests to help us come to a diagnosis, but majority of the time, a good pelvic examination is all that we need. And when we do these examinations, we know this is very uncomfortable for you as patients, so we make sure that you're very comfortable. We're listening to you, we're getting your feedback, and we'll make these exams as comfortable as it's possible.
And what are the main treatment options from physical therapy, I guess, all the way to surgery?
You're right. There are lots of conservative treatment options. And as we go along the treatment pathways, we may even talk about procedures and surgeries. No matter what we end up doing, it's usually a shared decision. We start off with conservative treatment options such as pelvic floor physical therapy, lifestyle changes, medications, office-based therapies, and then it may escalate to operation room-based therapies. And even when we take patients to do procedures and surgeries, these are usually all minimally invasive surgeries and procedures with a quick turnaround, and patients tend to make a full recovery very quickly.
So you go from therapy to surgery. Why would you need surgery for these conditions?
When we've exhausted all the conservative treatment options and they are just not working for you, it's time to sometimes talk about simple surgical procedures. Majority of the procedures are minimally invasive outpatient surgeries. There may be few surgeries where you may have to spend a night with us, but most patients make full recovery and are back to their normal walk of life, taking care of themselves very easily within a few weeks. So some of the surgeries that we would recommend for bladder leakage would be some outpatient procedures, where we support the neck of the bladder with hammock-like structures to give them more support. Or we would do vaginal reconstructions where we would once again reconstruct the vagina walls and place it back in their normal position so that you're functioning more optimally. We also recommend some surgical minor treatment options for women who may be having bowel leakage. Makes a big improvement in their quality of life, and it's a simple outpatient procedure. So there are lots of options where surgery is the right choice. But majority of the time, people should first exhaust their conservative treatment options.
You talk about lifestyle changes. What kind of changes?
Weight being an important one. Those patients who are smokers, they are highly encouraged to avoid smoking, to get in your best health parameters as possible. For example, controlling your diabetes. If you have not been using any estrogen cream in the vagina, sometimes using just a little bit of estrogen cream is all that we need to do to make a lot of these symptoms become much better.
Because that estrogen cream, what that does is it actually thickens the wall.
You're right. So vaginal estrogen cream restores elasticity. It also restores the normal bacterial flora of the vagina, reducing bladder infections, vaginal infections, and can have lots of benefits. It's a small thing to do, but can have big impact.
How effective is pelvic floor physical therapy?
Pelvic floor physical therapy is very effective. And it really does take the buy-in from the patients as well. And so when we put in the orders for pelvic floor physical therapy, you are directed to one of our many locations where we have a complete pelvic floor rehab programs. And once you call them, you'll have a one-on-one session with our pelvic floor physical therapist. It starts off by just talking about your goals, and as we move on through the therapies and identify your specific goals, will help you with getting the best out of your pelvic floor, be it core strength, be it relaxation. There are lots of different techniques within the realm of pelvic floor physical therapy that may be tailored to your specific needs.
And once again, these are one-on-one private sessions.
You're absolutely right. One-on-one private sessions.
What can patients do at home to strengthen their pelvic floor?
So, if you choose to do this on your own, there are lots of ways a physician or a pelvic floor physical therapist can guide you about the correct technique for exercises, how often and what times of the day you should be doing them. And then we can, put you on the right track. Sometimes we may even direct you to some informational videos that come from very reputable sites to help you figure out how to do it right at home and give you that extra coaching that you may sometimes need.
Once you start doing this pelvic floor therapy, is that something that you do, for a certain period of time, or is that basically something you do for the rest of your life?
I would say it's like a good habit. You've got to keep up with it. So, a physical therapist or a physician is going to give you the tools and get you to the right place. But after that, maintenance is highly recommended. So, you would have to continue to do it.
Why is it important not to ignore symptoms like leakage or pressure in the pelvic area?
For one, sometimes it may be an indicator for something more important. For example, pain is something that could mean you have a bladder infection, and infections are something that can be easily treated and should be treated in a timely manner. But the other important reason it's important to bring it up to your physician is because at some point it begins to affect your quality of life. You begin to retract from social engagements and go out less, which is not great for your well-being. You may start pulling back from exercises and physical activities, which has its own detriment. So I would say that it's important to bring it up. It's not something that one has to live with.
Let's say you have this bladder leakage, when you cough or you sneeze, your bladder leaks. I mean, at what point should you go see a doctor?
I think the earlier we see you, the better it is because we can start you on some conservative treatment options, and maybe that's all that we need. But even if we see you later in life where it's beginning to really affect your quality of life, I would definitely tell you to connect with us at that time because we know that it's affecting your ability to live your best life. And that's when it becomes an important issue.
What's your advice for anyone who is hesitant to seek help? And how can they connect with Scripps?
First of all, we all understand that this is something very embarrassing for all of us, be it women or men. And so it's really hard to even speak about it to your physicians. So I think the first thing is just to speak about it to your primary care doctor, and they will most likely direct you to the right specialists. Remember that in Scripps, we have people who focus their practices just to these issues. So they have a wealth of knowledge and expertise and will not dismiss your concerns. Once you see us as an expert, we understand that this is something that took a lot of courage to bring up. And so we're not going to dismiss your symptoms. We're going to listen to you. We also know that all of us come in here with different goals, what we want out of life, what we want out of therapies. And so we want to be able to acquaint you with all these treatment options, and you can pick and choose what's right for you at a given time. So I think it's not that you are going to be forced to be treated. It's a discussion, and that's how it all starts. Just learning about you and your story.
Any final thoughts, doctor?
I am so happy to be in this field. Taking care of women on a daily basis, improving their quality of life is my greatest pleasure. And I am so glad and thankful to many women in the past who have trusted me with their care. My take home message to everybody would be don't be embarrassed to discuss this, be it with your doctor or your friends. You're not alone. One in every three women have this condition. The more you talk about it, the more you'll normalize learning about these issues and discussing it with your physicians. And once you bring this up to you, we're going to put you in the hands of the right people who can help you and meet your expectations and your goals. Like I said, it's just not me throwing the options at you. It's about me educating you and you arriving at a decision that works best for you.
Doctor, thanks so much for joining us. We appreciate you taking the time.
It's my absolute pleasure.
If you want more information on how to diagnose and treat pelvic floor disorders, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.